branches of pathology. See, each branches of pathology is interconnected. First of all, you know that whenever you have to study about one disease, okay, you have to study the many things. You have to understand about the, you can say, the histology of a disease, okay, histology of a disease. You have to also understand their cellular level, okay. You also have to understand their molecular level. Apart from it, you have to also understand about their, you can say, the fluid changes. Fine. So these things diverge the branches of pathology. So when you have to study the tissue, you can say the tissue abnormalities, that is called as the histopathology. That is called as the histopathology. This is the one branch. Now, and you have to study about the cell abnormalities, then that is called as the cytopathology. Cytopathology. When you have to understand about the you can say the genetic abnormality in the cell, that is called as the cytopathology. That is called as the cytogenetics, specifically cytogenetics. Now, when you have to understand about the you can say the fluid and circulation changes, then that is called as the hemopathology. Now, when you have to understand about the adverse effect of a drug which you use to manage the disease, but that will result into the adverse effect, also called as the side effect. That branch of pathology is called as the toxicology. That is called as the toxicology. Now, there is one you can say the branch, okay, which deals with understanding some of the you can say the problematic situations. The forensic pathology. This branch deals with understanding about, you can say, the criminal activity, okay. Criminal activity. It also study the, you can say, the rape cases victim, okay, or any crime, okay, or any related crime. So this is called as the forensic pathology. This is called as the forensic pathology. Then you have another branch which specifically deals with the understanding the nervous system diseases. That is called as the neuropathology. It is called as the neuropathology. Got it? Other branches, the one is called dermatopathology. Dermatopathology, and another you have is the clinical pathology. Clinical pathology. Now, one just quickly revise. The histopathology specifically deals with understanding the tissue characteristics, okay, abnormalities in the tissue. Then you have the cytopathology, understanding the abnormality in the cell. Now, then you have another branch called as the cytogenetics, which basically deal the pathology in the genetics, okay, genetic problems pathology. Then you have the hemopathology, understanding about the blood and related blood disorders, okay. Then the toxicology, understanding the adverse effect of the drug, okay, or any other poisons, okay. Then you have the forensic pathology. It basically deals with the criminal activity, then the rape cases victims, and any other further any crimes, okay. Then you have the neuropathology. This neuropathology is specifically dealing with understanding the nervous system diseases, okay. Then the dermatopathology, which deals with understanding the skin diseases pathology, okay. Then you have the clinical pathology. This clinical pathology is basically you can say the main branch of the pathology where most of the diseases get the appropriate diagnosis, okay. So whatever test you seeing, like you can say the needle aspiration cytology, fine. Then there is something called as the PEP test. So all the tests, okay, all the investigation is done in the clinical pathologies. So these are the branches in the pathology. Now let's quickly discuss about the type of diseases and their cause. Okay, now let's come and discuss the type of diseases. Okay, so if we classify the diseases broadly, then there are four types of diseases. How many? Four types. The one is called as the developmental diseases. Here, these diseases start, you can say, in the early phases of the life. Okay, when baby is inside the mother, okay, and when immediately born, then those all problems which baby is suffering, that is called as the developmental diseases. Okay, there is one word in the, I remember about the developmental disease, is anencephaly. Anencephaly means baby is born with a half of the brain. Okay, all the brain structure is not properly formed. That is called as the anencephaly. Then there's a, you can say, congenital hydrocephalus. Okay, and there are many others. Those all are the developmental problems. Then there is a diseases which are, you can say, occurring of the microorganism interference. Okay, pathogenic microorganism interference, and that will result into the inflammatory diseases. Okay, that will result into the inflammatory diseases. The example is the tuberculosis. Non-example, then apart from it, there are pharyngitis, laryngitis, okay, all the microorganism diseases. Then you have the neoplastic diseases. Neoplastic diseases are basically a cancerous diseases. Fine, both non-cancerous and cancerous. Non-cancerous and the cancerous diseases. Cancerous diseases. Okay, that is called the neoplastic diseases. The example is the lymphoma, okay, or hepatocellular carcinoma. Shall I write? Okay, the example is lymphoma. Oma word is generally used in the reference of cancer. So lymphoma, then you have the hepatocellular carcinoma, then you have the leukemia. Okay, so these are basically a cancer. So that these all diseases are called as the neoplastic diseases. Then we have the another category of disease that is called as the degenerative diseases. This disease is mainly developed with the aging process. But it is not necessarily that is always happen in the aged person, but most of the time the degenerative diseases are start in the late phase of life. Okay, example is Alzheimer's disease. Okay, the another example is the Parkinson's disease. So these diseases is developed in the late phase of life. This is basically a here the body tissues start degenerating. Okay, there is the atrophy, shrinkage. Okay, or also the accumulation of certain toxic material. Okay, the beta amyloid body is a one kind of chemical, you can say, compound which is accumulated in the case of Alzheimer's disease. Okay, so memory loss, that is called as a dementia, is one of the clinical feature of Alzheimer's disease. Then in the Parkinson disease, what happened? There is a problem in the movement, something called as the dystonia, loss of muscle tone. Okay, kind of hemiplegia, paralysis. So these are the clinical feature of Parkinson disease, whereas the loss of memory in the old days is a clinical feature of Alzheimer's disease. Okay, so these diseases are called as the degenerative disease. Once again, just quickly revise, there are broadly four kind of diseases. The first one is called as the developmental problem. Here what is happening? This is start in the early phase of life. Okay, when the fetus is inside the mother womb. Okay, and after the birth, if they will born with half of the head, if they are born with a big head, okay, the big head, hydrocephalus, congenital hydrocephalus, half of the brain, anencephalus. Okay, then there is an inflammatory condition. Okay, interference, invasion of the microorganism, like example tuberculosis, pharyngitis. Then you have the neoplastic diseases. Okay, basically the cell abnormality. It can be the cancerous and non-cancer. For example, lymphoma, the cancer of the lymph nodes, and then the hepatocellular carcinoma, cancer in the cancer in the liver, then you have the leukemia, the blood cancer, okay. Then you have the degenerative disorder, means that you can say the cell start degenerating, atrophy, okay, shrinkage of the cell, loss of the cell, okay. And mainly this disease is happening in the old age. Example, Alzheimer's disease, clinical feature, dementia, loss of memory, okay. Then you have the Parkinson disease, a movement disorder. Fine, got it, no problem. Now, coming to understanding the cause of a disease, then broadly the cause is the two types, okay. The one is called as the environmental cause, another one is called as the genetical cause. Genetical cause is manifested in the many ways, which we will cover in when we discuss about the human genetics. But for a while, you just understand genetic disorder or those disorder which is occurring just because of interruption in the function of chromosome or a gene, or in the DNA synthesis, replication, transcription, translation, any process or at any level. Fine, these are the molecular diseases of the genetics. Then you have the environmental cause, okay. For environmental cause, what things comes? The trauma, okay, radiation, the nutritional deficiency, okay, you can say the toxins. Fine, so these things comes under the environmental cause, okay, whereas the another cause is the genetic cause. So these are the two broad classification of cause in the pathology. Fine, so now let's quickly recap our today's lecture. What we studied, we basically discussed about the first chapter in the pathology, okay, where we discuss about what is the mean by the pathology. Pathology is derived from a Greek word called as the pathologia, which is the English meaning is the study of suffering, okay. And in the modern terminology, we are basically referring as the study of the diseases. Fine, now the diseases is something which is, you can say, deviation from their natural normal physiological function, okay. That function is result in the form of a certain manifestation which is we call as the sign and symptoms, and this is caused by the you can say the causative agent, okay, that is called as the etiology. Then we discussed about certain terminologies in the you can say in the pathology, like what is the mean by the pathogen, what is the pathogenesis, okay, and what is the mean by the prognosis, the management. Fine, so what is mean by the sign and symptoms we discussed. Then we discussed about the classification of the disease. The diseases are the 4 types, okay. Then we also discussed about the history and the branches, okay. So in the next lecture we will cover about the another chapters called as the cell physiology and the cell damage. So thank you for having me. Bye. Have a nice day.